Pneumonia is a lung infection that has claimed countless lives over the centuries. It has always been a significant medical challenge, even with today's technology. In the US, there are 5 million cases of pneumonia yearly, with about 55,000 deaths, making it the 8th leading cause of mortality and cost the country billions of dollars to manage. But that is just in the US. Imagine it in a global scale. The number of infected cases could be 100 times higher. This disease has always been a significant medical challenge, especially in the past, when we have yet to discover the antibiotics. So how did our ancestors manage to fight the disease? And how are we fighting it now? What are the differences? First, let's start by looking back into the history. As early as the 5th or 4th century BC, Hippocrates, often called the father of medicine, has already mentioned pneumonia in his work Corpus Hippocraticum. He described it as the most serious lung infection, where the lungs would draw in the blood of mucus without expelling them, leading to swelling and building up pus. Although Hippocrates didn't have the technology like microscopes or PCR, his observations were remarkably accurate in describing the effects of pneumonia. But without knowing the presence of the cause, all he can do was to treat the symptoms and pray that infection would go away. Hippocrates noted that the patient should be treated with a variety of herbs for the purpose of treating expectorants via inhalation or fumigation, and in combination with medicine for anti-fever effects. Vapor bathing and having warm cruise were also helping with expectorant. Even though there is evidence that antibiotics-producing microbes were used in the form of moldy bread and medicinal soy in ancient times, Hippocrates did not mention this in his book, so it's uncertain if any natural antibiotics were applied in his methods. But the use of antibiotics might not be likely, because the mortality rate was so high to the point that Hippocrates himself noted down many signs signifying that the cases were beyond remedy. Things such as having difficulty breathing, thin and acrid urine, sweats coming out from the neck and head, dry cough, shaking chills, high fevers, chest and back pain. Treating pneumonia back then was like playing a waiting game. The consequences would depend heavily on the process of crisis, which lasts for about 3 weeks. During these critical days, if the patient could not expectorate, death was very likely. Fast forward to the 19th century, in the century just before the discovery of penicillin, pneumonia was still the most deadly disease on Earth. Even with our knowledge in lungs anatomy, breathing physiology, and bacteriology, without antibiotics, pneumonia cannot be treated appropriately and was still more or less a waiting game. The average mortality rate or death rate of pneumonia could be as high as about 13%, even rise up to 20% if bloodletting treatments were involved. By saying bloodletting, it is a method of bleeding the patient for the sake of balancing the bodily fluid. This data was collected in the hospital, so the real number may be more significant. To compare, the deadliest health condition nowadays is ischemic heart disease, only with a death rate of 13%, just equal, if not less than historic pneumonia. The uses of antibiotics in treating pneumonia only flourished after the discovery of penicillin by Alexander Fleming in 1928. Combine this with our prior knowledge, pneumonia death rate would gradually reduce to a single-digit percentage as of now. Nowadays, we know that pneumonia is when harmful pathogens like bacteria, viruses, fungi, or parasites invade our lungs and disrupt its normal microbiota in the alveoli. Our lungs contain many tiny air sacs called alveoli, which are the result of about 23 divisions from the main airway, the trachea. As we breathe, bacteria will enter the airway. They will be held back by the first defense mechanism, which is the mucus and the cilia on the surface of epithelial cells, but they cannot be held back completely. So time after time, our lungs will harbor a unique and abundant microbiota. When harmful pathogens appear and break the peaceful environment here, our body will trigger a series of immune responses to get rid of the danger. At this point, it is a war between our immune system and the pathogens, with our lung tissues being the battlefield. If our immune system is strong, it can get rid of the pathogens while keeping the battlefield clean and clear, thus showing no clear symptoms. In actual pneumonia cases, the battle is fierce, and the dead cells will accumulate in the form of exudate or fluid filling the alveoli. These air sacs are vital for oxygen transferring into the bloodstream, so when they are filled with fluid, shortness of breath occurs. This, along with coughing, chest pain, and fever, are the four most common symptoms of pneumonia. The presence of fluid in the air sacs is also what causes the characteristic rails sound. Which doctors detect with a stethoscope. It also one of the reasons for the distinguished image on the X-ray or CT scan film. In some other unfortunate cases, the host immunity is weakened for some reasons. For example, in the younger age when the immune system is not mature enough, or in older age where the immune system is getting weaker, or in conditions like advanced HIV or cancer. With a weakened immune system, the battle is even more extreme, to the point where it could damage the lung, thus affects other organs like the heart, the brain, or even lead to bacteria penetrating through the blood vessels and causing bloodstream infection or sepsis.
I'm in danger!
To save the patient, because this is an infection, antibiotics are the most effective weapons so as to kill or weaken the pathogen, thus helping our immune system. But if the patient is not hospitalized, bacterial diagnosis won't be conducted, so how can we select the appropriate antibiotics? Luckily, with the help of research and statistics, scientists and doctors now know the distribution of pathogens in the region. So empirical therapy, meaning the first step therapy, will contain antibiotics that cover the likeliest pathogens. Drugs like amoxicillin clavulanate, macrolide and azithromycin, or doxycycline are often seen in pneumonia prescription, along with other supportive therapy like paracetamol for fever and pain management, anti-inflammatory drugs, coughing drugs, and vitamins. With the right drugs, significant symptoms should be resolved in 3 or 4 days, and complete recovery should be in about 2 weeks for younger patients, or sometimes a bit longer for older patients. But if things don't get better in the first 3 or 4 days, additional therapy may be required, or perhaps the bacterial diagnosis should be conducted to choose the correct antibiotics. These cases are mostly individualized and often hospitalized, so it cannot be discussed in general terms. Pneumonia is an infectious disease, so apart from treatment, preventive measures are also equally important. The most effective preventive method for an infectious disease is none other than vaccination. The pneumococcal bacteria or Streptococcus pneumoniae, the main villain in pneumonia, were discovered in 1880s, and just 10 years later in 1891, studies of pneumonia vaccines appeared. Stemmed from the killed organism vaccine, it was later discovered that a type-specific capsular polysaccharide vaccine would be more protective and safer to use. Capsular polysaccharide is the long chain of sugar that cover the outside of the bacteria. This means that the vaccine do not require the injection of the whole bacteria, but just a part of it, which helps explaining its safety. But interest in vaccine began to wane with the discovery of penicillin in 1923, for scientists mentioned that the problem would be eliminated by antibiotics. So for nearly half a century later, research for vaccine became stagnant. However, evidence later showed that even with penicillin, death rates were unchanged in the first 96-hour therapy. So research for vaccine was back on the table again, and then thrived. In 1977, the PPSV23 vaccine was licensed. PPSV23 stands for Pneumococcal Polysaccharide Vaccines 23. It consists of the purified polysaccharide of 23 common serotypes of pneumococcal bacteria. The PPSV23 despite being the product of the past, is a highly efficient vaccine even at the present time. But the problem with this is that it often fails to immunize young children and the elderly. To counter this, the PCV vaccine was introduced. PCV stands for pneumococcal conjugated vaccine, which means that instead of containing only the polysaccharide, this agent is now conjugated or linked to a protein called CRM197 or cross-reacting material 197. CRM197 is actually a detoxified mutant of diphtheria toxin. When linked to the pneumococcal polysaccharide, the compound can effectively manifest immunity in infants or toddlers, as well as the older people. It also provides more stable immunity, as it involves the T cell and the memory B cell production. The earliest version of PCV vaccines were PCV7, meaning it would render immunogenic against 7 serotypes of pneumococcal bacteria. Later, PCV13, PCV15, PCV20, and PCV21 was developed one after another. One thing to note is that the pneumococcal bacteria, or Streptococcus pneumoniae, has more than 100 serotypes. It is difficult to include all serotypes in a single dose of vaccine, and the latest vaccine only covered the most common serotypes, up to 21 serotypes for PCV and 23 serotypes for PPSV. That means it should provide decent but not absolute protection from pneumonia. Scientists are still working to figure out the serotype-independent vaccines, which means a vaccine that can provide the ultimate protection against all serotypes of pneumococcal bacteria. Aside from the pneumococcal vaccine, the influenza vaccine, also called the flu shot, is also recommended. Influenza vaccine provides protection against the influenza virus, thus protecting people from developing viral pneumonia. Unlike bacteria, the virus can change and adapt very quickly and constantly, so annual flu shot is required for optimal protection. Additional to vaccination, general hygiene and a healthy lifestyle can tremendously help in preventing the disease. The exposure to pathogens like bacteria or viruses can be cut by hand washing with soap and avoiding contact with people who are ill. If a family member with pneumonia needs help, a face mask is a good accessory to avoid inhaling any pathogen by chance. And because the reaction to the pathogens is mainly dependent on the immune system, having a healthy lifestyle surely will boost immunity against these pesky bacteria or viruses, so even when a battle do happens, its consequences won't be as severe. Pneumonia is surely a dangerous condition from ancient history to the present time, with the number of cases and mortality stand at the top every year, despite having all modern technology helping. So having a basic understanding of the disease might somewhat be beneficial, and hopefully you have just achieved that after watching the video. Please consider subscribing for more content about healthcare in the future. Thanks for watching. This is Coffee at Dusk, and see you soon.